Hello everyone, myself Ashit Desai, Assistant Professor, uh, Service of Technology, College of Engineering. Today we are going to discuss on medical robotics. So the medical robotics, which involves the use of robotic system to assist the medical procedure, diagnosis, rehabilitation, and patient care. So these are the activity which is involved in a medical robotics. So the importance which is in a medical robotics are the enhances the precision, reduces the human errors, also improves the efficiency and enables to the minimal invasive surgery. So the minimum the scales are available because of the robot surgery. So these are advantages points of the medical robotics. So whenever we are going for the applications, so it may be make a surgery, rehabilitation, the prosthetics, telemedicine, and diagnostics. So these are the main application of medical robotics. So while thinking about the key technology which is used in medical robotics, so first one is robot arms and surgical assistance. So enhancing the precision in operations, we are preferring the that surgical assistance by using the robotic arms and all the equipments, and we can do with the surgery. The next is about AI and machine learning. So nowadays we are implementing the AI and machine learning in a that uh, improvising the diagnostics and while making a decision makings. The next is about haptic feedback. So surgeon can be take the real time tactile feedback by using this that using the different tense sensors, and then we get the idea about the what type of disease is there or what type of causes are there. So we can find both that is by haptic feedback. Then teleoperation and remote surgery. So it is enabled by the remote process. So we are at enable we are at the remote places which handling the robotic systems. So it is called as a teleoperation and remote surgery. The next is about autonomous vehicles. So sorry, autonomous robotics. So which is assisted within a patient care. So tele care robot is present. So that is about autonomous robotics. So monitoring is doing with the robot. So that is a possible in the medical areas. So now we are going to discuss the types of medical robots. So first one is surgical robots. So it is assisting in a complex procedures. Then rehabilitation robots, which is helping in a patients which is regain the mobility. So by using exoskeleton and robotic prosthetics, that is by using the Bikram conditions. So we are a rehabilitation robot. So here the patient or that system we can get mobile with this system that is called the rehabilitation robot. So we are using different devices, and then the patient can regain this mobility. So that can be called as a rehabilitation robots. The next is about telemedicine robots. In that case, remotely the diagnosis and treatments we can carry it over there. That is called as telemedicine robots. The next is about diagnostics robots. So nowadays, diagnosis is required in a fast manner, or getting a result in a fast manner, or finding the finding the exact uh, exact diagnosis which is helpful by the diagnostics robots. So we are using the automated status, and then we are formulating the diagnostics robots. The next is about pharmaceutical robot, because this is the important area, because we are automating drug compounding we can do over there, and then we can use it in a pharmaceutical the formulation. So we are using the pharmaceutical robots. So these are the different medical robots are available with us. The next is what are the advantages of medical robots. So we are reduces the surgical trauma, or can say the scares, and recovery time will be also increased because of the minimal invasive procedure. Second advantage is the reduces the human efforts and human error also we can reduces, that is by using the robotic system. So that is means what, the enhancing the precision and accuracy. The next is about remote accessibility. So it is enabled to assess the healthcare in a remote areas. So we can operate the that remotely we can assess will be there. Then increase in the efficiency. So reduces the workload on medical professionals. So that should be possible. That is called as increasing the efficiency. The next is about personalized healthcare. So AI driven diagnostics and treatment recommendations. So that is also possible in a personalized healthcare. Now, next is about challenges in a medical robotics. So, the high cost, then regulatory approvals. So, main challenge is high cost because we are expensive for the development and maintenance. Next is about regulatory approvals. So we can take the safety precautions and then we are having the regulatory efforts required. The next is about technical limitations for the need of high precision and reliability is required. The next is about integration with existing system. The compatibility with hospital and infrastructure is required over there. The next is ethical and legal concerns. So liability and patient data security is required over there. So these are the main challenge for the medical robotics because we are using the robot in surgery or medical various procedures, or you can say drugging system or diagnosis system. So we are using the robots here. So these are the main challenge focuses over here. Now next we are discussing the mobile medical robots with aids for the people with disabilities. So different equipments we are using for the disabled person. So if you firstly look at the prosthetic limbs, so here the advanced bionic limbs which is available with a sensor and AI, so which is getting the natural movements for the system. Then exoskeleton, so we are wearable robotic suits which can assisted in the walking and with mobility impairments. The next is about robotic wheelchair. So here the wheelchair is possible to which is having AI powered and which is obstacle detection and voice control effectively use can over there. So that type of also aids we are providing for the that mobile person. So which is having the some disability as are there. The next is about assistive robotic arms. So sometimes helping the limited arm movements which can perform in a daily task. So we can do with the robotic arms. The next is brain computer interface, that is BCI. So it allows very paralyzed persons so which can control the devices using brain signals. So that is also called as a BCI, that is brain computer interface. The next is about smart home integration. So that robotic assisted in daily activities like opening doors, switching lights, and using applications. So that also integration for the required for the doing with the for the disabled person. So this is the activity we can do with the medical robotics. The next is rehabilitation. So it refers for the process of helping individual recovery from the physical, mental, or cognitive abilities that can be lost or impaired due to injury. So that should be evolved. So that is helpful for the persons which is giving to the injury person or illness person. So this is the rehabilitation equipments. The next, it includes for the therapy, exercises, and assistive technology to improve the mobility, strength, and independence in a daily activities. So this is the advantages of rehabilitations. Now, nextly, we are discussing the about the prosthetics and orthotics. So, orthotics is the first of all we discussed regarding the prosthetics. So, artificial limbs designed to replace the missing part. That also can be possible that the aesthetics or functional medical bionics are also possible. Then examples for the bionic arms, robotic legs, and 3D printed prosthetics. So it is possible. Orthotics is the about users to enhance the functioning weakened or impaired body parts. So includes the braces, splint, and shoe inserts. So used for condition like scoliosis and cerebral palsy and foot deformities. So these are the areas we are finding in orthotics. So this is the main category we are doing with the helpful for the prosthetic and orthotics. So now we are going to discuss regarding the future trends in medical robotics. So first of all, we discuss regarding the advancement in AI and machine learning. So nowadays, more accuracy and more preferred decisions we are taking with the help of advancement in AI and machine learning. So we can use in the future trends for the medical robots. So next one is miniaturization and nanorobotics. There is tiny robots for targeted drug delivery. We can employ for that. The next is improved haptic and sensory feedbacks. So we are having the different approaches like robot assisted surgery. So can giving by the haptic feedback. So easily the surgeon can be identify that about how much the disease cause are there and how many extended part we are having. So that can be identified by the haptic feedback or haptic sensors. The next is about 5G and auto integration. So nowadays it's also really real data remote operations. So it is useful for this 5G operations. The next is about human robot collaboration. So enhancing the interaction between doctor and robot So it is possible through this condition. So these are the future trends which is available in the medical robotics. Now we are going to discuss the point related with medical, that is conclusions. So in this lecture we are discussing the how the healthcare is transformed for the precision based as well as efficiency based and patient outcomes. So this is discussed areas. The next is about continuous innovations will lead to more accessible, uh, and safe and cost effective solutions we can provide with this medical robotics. And also the future of robotics which is based on AI driven and machine learning system which is having for the personalized healthcare. So these are the areas we are discussed in this lecture. Thank you.